Okay, so the grumbling gut, which you're also known as Z or Z-ad, but on Instagram you can find the grumbling gut. So Z provides education on inflammatory bowel disease and hopes to break stigmas and myths about IBD. The Grumbling Gut offers nutrition and weight management services, free resources, and soon an IBD and gut health course. This amazing advocate, volunteer, and clinical research radiographer is today's guest. So go ahead and say hello and introduce yourself.
Hi there. So my name is Ziad, as you said, obviously. You may know me as the Grumbling Gut from social media, so my Facebook, YouTube, Instagram. I'm an NHS research radiographer here in the UK, and I also work as a nutrition and weight management advisor, helping clients, um, change their eating habits for a better lifestyle and just get on top of their nutrition. I also have an interest in medical research and how to improve patient experiences within healthcare. And that's partly stemmed from my own experiences as I was diagnosed with Crohn's disease in 2007.
Wow. So speaking of Crohn's disease, I get kind of confused when it comes to gut health because there's so many
There's so
and
much, I know, yeah.
yeah. And so I have Ehlers-Danlos syndrome, which comes with a lot of gastrointestinal issues. And
Sure.
I see a gastroenterologist, which in fact I'm having a colonoscopy on Tuesday. But I've been dismissed often, and usually like before hearing anything that I have to say, I get the whole, yeah, you have IBS, have a good luck, and they send you out the door. But it's confusing to me because I'm like, there's IBS, there's IBD,
Mm.
there's colitis, ulcerative colitis, there's Crohn's. So can you give me like a little bit of education on the difference of all of those?
A whistle-stop tour.
Yeah.
So I suppose the main thing that all these gastrointestinal disorders have in common is that they affect the gut,
Hmm.
and they have common symptoms like diarrhea, constipation, bloating, flatulence. In my case, I've got Crohn's disease, so it's one of the two main forms of inflammatory bowel disease, or IBD, as many people kind of hear about it. So Crohn's disease is one of the two main types, along with ulcerative colitis. But there's also two commonly less known subtypes of IBD, known as microscopic colitis and IBD unclassified even. And they're lifelong conditions, and it's characterized by the inflammation of the gastrointestinal tract, or your gut, basically. And depending where this inflammation occurs can depend on what the type of IBD you have. So in my case, I have Crohn's disease, and that can affect from anywhere from the mouth to the anus, whereas ulcerative colitis only affects the large intestine.
Okay.
Now, with microscopic colitis, it it does affect the large intestine, but you can't see the inflammation. So obviously, you said you were going to have a colonoscopy, and that just puts a tube up through your bottom to have a look at the internal health of your intestines. With Crohn's disease and ulcerative colitis, you can see ulceration, inflammation, bleeding in different portions of the intestine, and that can help classify the type of Crohn's disease or ulcerative colitis you have. But with microscopic colitis, you can only see that inflammation under a microscope, hence its name. So the way they do that is when they do a colonoscopy, they take a little sample of your colon, and they look at that underneath the microscope, and if it shows the characteristic signs of microscopic colitis, then that's how they diagnose you. There are some cases where they can't really give a diagnosis of either Crohn's disease or ulcerative colitis or even microscopic colitis, and that's when they use the term IBD unclassified.
Okay.
And it is a clinical entity on itself, but it's also known as indeterminate colitis. And it's almost a mishmash of Crohn's and colitis and microscopic colitis, which is why they have kind of no idea what to call it. And I
Right.
suppose people with IBD unclassified, they later on develop the more obvious symptoms or presentations of Crohn's disease and ulcerative colitis, and then later on they would get a diagnosis of one or the other. Yeah, and with IBD in general, they just share common symptoms. So abdominal pain, diarrhea, fatigue, tiredness, anemia, appetite loss, weight loss, and bleeding after each bowel motion. And the severity and frequency of each symptom will be different in people, and they won't present it at the same time. So someone could just have abdominal pain for a while and then later on develop bleeding after bowel motions, whereas someone could have the complete reverse. And we don't know why we know why the symptoms occur because of the inflammation of the intestines, but we don't know why IBD happens. There are so many theories as to why it may happen. So person's genetic makeup, or autoimmune response, or even environmental triggers. It's just all very confusing what exactly causes this condition.
Yeah. So I have a random question. I know I had made a post the other day about things that don't cure my illness. I know that having gastrointestinal issues, I'm sure many people get comments about what they can do to fix that. And you said it's a lifelong illness. So, I mean, is there anything that can help it or cure it or get rid of it? I feel like there's a lot of people that try to push the diet. I imagine that it could kind of make it better, but not necessarily cure it. Or does that depend on the situation?
Yeah, well, so I think the first thing to start off with is there is no cure for inflammatory bowel disease. No matter how many DMs I get about Dr. So-and-so's magical herbs that's cured herpes and all of this.
Oh, that's like every post.
None of that is true. So there is no cure for IBD. But there are things you can do to manage the symptoms. So obviously treatments, medications, and they're coming up with new biologics and immunosuppressants and things like that designed to suppress the immune system and work on certain parts of your body that is thought to cause all this inflammation. So that helps in symptom management. And if you're lucky enough, like I am, it sounds like a bit of a brag, but I'm currently in remission. So, touch wood that can still continue. But if you are lucky enough to get into remission, I feel it's very important to distinct between remission and a cure. So a cure implies that the disease has gone forever, whereas remission just means it's gone to sleep. So I like to use the sleep analogy. It's just had enough of bothering you. It's tired. It's gone to sleep.
But it could wake up at any moment.
Precisely. It could wake up at any moment and cause you symptoms. And unfortunately, that's what we experience when we have flare-ups and things like that. In terms of diet, I'm also through my nutrition and weight management business, I'm a huge advocate of, trying to eat clean and, just enjoy food and everything. And there is a lot of fear when it comes to food and IBD and other chronic illnesses which are involved with the guts, because
Absolutely.
what I found personally when I was going through my symptoms, I was in excruciating pain after each meal. And I kind of clocked onto the fact, right, yeah, if I eat, I'm going to be in pain. And the only way to not be in pain is to not eat. And
it gives you like a eating complex.
Exactly. And unfortunately, I didn't realize it at the time or admitted it at the time. But looking back now, certainly, I did develop an eating disorder because of my Crohn's disease. So I didn't go off food completely. There were some foods that I would still eat and that would help sustain me through the day. But a majority of the things that were put in front of me, I wouldn't touch. And you can really see the weight loss being accelerated, and I was looking really sick and really depleted of energy. And that unfortunately, I had to develop that to be taken seriously by my doctors in the end.
Right. Yeah, that's true.
And in terms of the foods that I had to eat and things, that was a very long sort of journey. And what people find is that there are certain foods that they can't have, and it's different for everyone. So personally, my trigger food is rice. If I have it,
Wow.
yeah, I
That
know.
seems like a comfort food.
A lot of people are like, "Are you crazy? Rice is the staple diet of everything." And I'm like, "Well,
Wow.
unfortunately, if I have it, I'm just going to be really ill and be in a lot of pain." And
So did you
everyone's
figure
trigger.
that out by just trial and error? Like, okay, this is like the fifth time and the only thing was right, because that's a hard process of
Mm.
elimination is so hard.
Yeah. So essentially, what happened was I saw a dietitian, and
Okay.
I had to keep a food diary, track of my eating habits, how I felt after each meal and everything. And she was amazing. She like analyzed it and everything. And unfortunately, I had a really bad flare one time, and it was decided that I had to go on the liquid diet, so enteral nutrition, and that you cannot have food at all for I think I was on it for 6 weeks, and it
Wow.
was so tough. And you'd never realize how good food looks when you're not allowed it. Even like
Mm-hmm.
even the foods you don't usually eat. And when I went into the reintroduction phase, we slowly introduced foods, and I still had to keep my food diary. And it was just a common factor. Every time I had rice or a food that's main ingredient was rice flour or main component was rice, I would just be really ill the next day, or depending how much I've
Wow.
had of it, it would depend what I would experience. And so if anyone is thinking of changing their diet or eliminating any food, I would say don't do it unless you're under the supervision of a dietitian, because if you have a chronic illness that affects the digestive tract, you may have other nutritional deficiencies which need to be addressed as well. And it's just safer to get the right professional help.
Right. That's a good point too. Speaking of nutritional deficiencies, I believe it's common that a lot of people with Crohn's disease or gastrointestinal issues do end up having deficiencies due to malabsorption. Have you experienced any deficiencies?
Yeah, so I was very anemic. So I had iron deficiency. Can't speak. Iron deficiency anemia, um, and that's just it doesn't help at all, especially with the fatigue and the tiredness
Yeah,
and
that makes you so tired, very tired.
incredibly tired. And people just say to go to bed earlier, and it's so not the same. And I find those are one of the common themes which people do message me about. How can I handle fatigue? How do I cope with it? What things do I personally do? And there's currently I'm getting a lot of messages of how can I explain it to people? How can I explain that this is just not I didn't get enough sleep? It's a full body shutdown where you physically
Yeah.
can't do anything.
It's
And
like basically having the flu, but you don't have the flu. Yeah, that's usually how I try to explain it. It's like, oh, you've had the flu before, or
mm,
or fever is just not feeling well, and that's what it's like every day.
and I've told my I mean in this current pandemic with COVID, I've seen people that have had it and they've described the exhaustion they felt, and they were just sleeping all day, and even getting up to brush their teeth or lifting up the TV remote was the most difficult thing in the world. And I just say, if you've had COVID and you experience that type of fatigue, that's kind of what we go through on a daily basis, and that's the
Hmm.
only way people would really understand it.
Yeah, that's absolutely true. I actually have a blog post, or might make it an episode of how to listen to your body, and one of the things I'm including is just like what your body is showing you. So, for example, for me, I'll notice when I get super tired like that, where I just feel so just drained, and it doesn't matter if I sleep all day, I'm still going to feel that way. So, I'll look out for bruises when I start seeing that I'm developing bruises for no
Mm.
reason. Then to me, that's how I'll listen to my body, and that shows that I'm at that point where I'm becoming anemic, and then I'll supplement, and then I'm like, okay, that's what it was. Because it's kind of, we can be very mysterious sometimes in that way.
Mm.
So I would love to hear about your diagnosis process. I know a lot of people, their diagnosis process varies from, several years to like getting a diagnosis right away. So tell me more about your process.
Sure. So I experienced symptoms when I was 16. So back in 2006. Yeah, my maths is correct. So it was at the end of my GCSE exam. So we have, before we could go on to do A levels before university, we need to pass our GCSE exams here in the UK. I'm not sure what they're called in America. Is it SATs or
Yeah.
something like that? Yeah. So all of that was done, and it was very easy to pass off any, ill health I was experiencing due to that experience. Because, a lot of late nights and,
Right.
you go to school, revise, come home, homework,
And
exams,
probably like
revise,
junk food.
junk food, McDonald's, whatever you name it. If it was within reach, I was eating it, because, nutrition isn't the
Right.
first thing on your mind when when you've got exams. So I was just really run down, and it felt like a flu. That's all I could say, and I can't really pinpoint the exact time they happened, my symptoms, but they just gradually occurred, and I was feeling weaker, fatigued. Wasn't eating that much. I started to develop stomach pains, and obviously go to the doctor, and they're just like, oh well, you're just a little bit stressed,
Stress.
because yeah.
I knew it.
it's, it's almost as if they have it prepared. Oh, stomach pain. Yeah, you're just a bit stressed.
Yeah.
So they were just saying I was just a bit stressed. I wasn't having a good diet and lacked a bit of fiber. And, once I address those issues, it will sort itself out. But as time went on, it just got worse and worse and worse. And there were times where I would be in so much pain that I couldn't get out of bed. I couldn't go to school. And it started to the point where I was missing a lot of school. And my friends and my teachers were starting to notice. And, my physical appearance was still starting to show as if I was almost skeletal. It got to the point where I was almost a bag of bones. And
Wow.
that was because, as I mentioned earlier, I did develop that eating disorder. And it wasn't until, I was almost skeletal thin, and I was up all night vomiting, in pain, and passing so much blood after the loo that, my doctors took me seriously. Like every time I went to the doctors, I went on my own, because I'm like, oh, I'm 16. I can, I'm a big boy. And, you kind of just put your trust in the medical professionals. You're like, oh, okay, I'll eat more bread.
Right.
I'll buy brown bread. I'll meditate,
Yeah.
I'll do
I'll do the
something.
kale and yoga.
I'll do the celery juice.
Oh yeah.
And obviously, I was fit, young, healthy. I did a lot of sports, and I was still doing all my sports and trying to keep up appearances as well. And obviously, with everything that I was going through, my body was just being sapped of any energy. And my family, they see me every day, and it got to the point where they always ask me, am I feeling all right? You don't look well. And I'm like, I'm fine. I was hiding my symptoms from them, because
you get used to it. I feel
yeah,
like over time, your
because
threshold of what's not normal, when you're told too bad, you got to deal with it, that's normal, it continues to move up, and it's like, oh yeah, I bleed, and I all of these crazy things, and it's like, oh yeah, that's no big deal, just another Tuesday.
100%. Honestly, and I mention it in some of the blog posts I write about it. I accepted that was my life. I'm like, okay, this is kind of normal. It will pass. I just got to have a bit of brown bread every now and then, and I'll be fine. But as time went on throughout that year, I was looking sicker and sicker, and my family were like, what is going on? Are you being bullied at school? Are you unhappy? Are you on drugs? What?
No.
You don't look well. And I'm like, oh, I've just been having stomach pains, and being up all night. And every time I was up at night suffering, I wouldn't wake anyone up because I didn't want, it's not sympathy, but I was just like, this will pass, you know?
Mm-hmm.
And
Well, and we tend to feel that we're a burden, like we don't want to bother people. And
precisely.
it's just, I don't know, but that's just kind of where I feel like our mind goes,
Yeah.
like
You
this is
don't
our
want,
thing. We got it.
this is our jam, leave us to it,
Which isn't always the best,
No.
but
But it got to the point where they pretty much frog marched me to the doctors and came with me. And luckily, I was seen by one of the doctors that saw me regularly. And my parents were like, look at him, this isn't normal. And luckily, because that doctor did see me quite regularly, he was like, he does look very, very different from the last time I saw him. And then I'm like, yeah, I've been up at night, bleeding, vomiting, and stomach pain. And then obviously they did some blood tests, and I was anemic, and everything else was just off the charts, and I was just in really bad health. Then they just sent me to a specialist where I had all my, CT scans, MRIs, barium scans, and it's kind of romantic in a way because that's what I do now. So that was
yeah.
my kind of first experience of being
Wow.
a majorly sick patient. And then boom, got my diagnosis after a colonoscopy. And I thought it would end there, but I really wasn't, emotionally or mentally prepared to hear there is no cure.
Mm.
My understanding of disease is like I wanted to apply for medicine um, at university. So I've always been interested in following a medical career. My understanding of diseases and school and everything, there's a disease, there's something to treat it, it will go, you're fine. And
Right.
that's what we get taught at A level and in secondary school. And to be told at 17 there is no cure, I just internally I couldn't handle it because I'm like, is this my life now? Like my body changed. Am I going to look like this forever? Am I going to be up all night doing that through my entire life? I just mentally I couldn't cope with it. And
Mm-hmm.
I never spoke to anyone about it, or I spent a good 8 to 10 years keeping all of my emotions, just to myself.
Yeah.
And I don't
I
advise to
hate
do
that.
that.
I hate to hear that because I feel the same way. I've have, major heart issues, and that's, I deal with depression, and that's always been a big factor in that.
Mm,
And it can be scary sometimes it because you kind of get that stigma of, oh, it's just stress, or it's all in your head, or the whole stress thing
yeah,
mostly. You kind of live in a little bit of fear about discussing that you're stressed out, or that
yeah,
you are a little depressed, because that kind of tends to be the blame to all of your illnesses,
yeah.
at least here in the States. And so that was just something I never even acknowledged. In my 20s, I never even thought, like, yeah, I have depression, or I might have
Mm,
PTSD, or I wish that there was a way to incorporate, like, okay, you just got this diagnosis, and this diagnosis, you should also, it should be followed up with some type of mental health,
yeah,
care, or a therapist, because it's such a huge burden to carry, and we don't know what to do with it besides just keep it within us, and letting it affect us in so many different ways.
definitely. Especially if it's a first time diagnosis
Right.
of being majorly ill. Like, I've been ill before. I've had the flu. I've had, food
Mm-hmm.
poisoning from the dodgy kebab, I had on the way home and things, but nothing in my head that was, this is for the rest of your life, Zia. This isn't going to go away in a day or two. This is your new normal now. And I
Right.
know people, even in this pandemic, have been struggling to get to terms with, the isolation that COVID has caused and things. And I do have some sympathy with them, but at the same time, I'm like, that was my normal 10 years ago.
Yeah.
I didn't go out anymore because I was always worried about where the nearest toilet was, or
Mm-hmm.
if I was to go out with my friends and eat dinner, am I gonna have the energy to get through that night? Am I gonna be sick
Wow.
because of it? And socially, and even football. Football was my one thing I refused to give up, because mentally, it just, for that hour and a half, I'd forget everything.
Yeah.
And even though the exhaustion afterwards, I could say wasn't worth it, but to me it was, because it was still a social aspect. It was good for my physical health and my mental health.
It's good to have an outlet for sure.
Yeah, but
So what do
everything
you
else,
recommend for coping and dealing with that and versus holding on to it for so many years?
I think, don't do what I did and
Yeah.
bottle things up. I remember the first time I told my best friend at uni, and I feel kind of lucky because it was all just coincidental, because it came up naturally in conversation, and we were doing a biomedical degree, so everyone knew about digestive illnesses and had a theoretical understanding of it. And when I told him, I'm like, look, I've got Crohn's. This is how it affects me. This is why I've like missed some lectures and things. And they were just like, oh, that's cool. My brother has it as well. And I'm like, oh, and that was it. It just wasn't spoken of again. But in their mind, it was, I understand if he has to cancel something. I understand if he's not at the
Yeah,
lecture. If he's not in the lecture, let me reach out to him. So
that's important.
I would say find a group of friends which you really trust and connect with, and build a support system with them, and don't hide it, and don't be ashamed or embarrassed about it, because everyone goes to the loo. Just unfortunately, we go a bit too much and may bleed after a bit, and I find
Oh,
just that would just help mentally as well, because you can send a
yeah.
text, hi, I'm not feeling well today, I can't come," and then they'll be like, no
They'll get
problem."
it. Yeah,
They'll
versus
get it, yeah.
having no idea and then they're just like, "Oh my gosh, that person always cancels."
And I've
It's
I've lost I've lost friends that way, and
yeah.
it is in part my fault for not being as open. But at that young age, it was my private life, and I didn't want to share it, or didn't feel like I could share it.
Right. Um, so I see that you have research publications from 2013 to 2020.
Yes,
I actually just started my biomedical science degree. I love
nice
that a
one.
lot of us in this community are like getting into healthcare. It's so cool. So tell me more about your background with medical research, and then yeah, we'll start with that.
So it's a bit of a long story. So as I mentioned, I wanted to do medicine and become a doctor, but unfortunately, I was starting treatment for my Crohn's during my A levels, and I you have to get really good grades to get into medicine and everything. So I said to myself, let's just lower the bar a bit and apply for biomed. And not saying that it's a substandard degree or anything, but just at that time, I'm like, I don't want to waste my university options on something I know I'm not going to get into, and I'd rather do something related. And I'm so glad I did anyway.
Mhm.
So I did biomed, and then I gained an interest in fertility and pregnancy. So I went on to do a master's in reproductive medicine, and that was really all about male and female reproductive health and IVF. And I was lucky enough to do my thesis at a fertility clinic. And my supervisor at the clinic was really impressed with my work, and he offered me a research lab post.
Oh
So I'm
wow.
like, okay, let's see what this is all about. So I was working as a reproductive technologist, and later on, I went to be a in-house trainee embryologist. So I was there in the lab with helping couples get pregnant through IVF and ICSI and all these different techniques. And I was also researching multiple pregnancies, and that was one of my main focuses as a researcher. And I was fortunate enough to get what I was researching published, and that kind of started the whole publication process.
Yeah.
It was kind of a drug to see your name in print and in black and white and go, I did that. That's so
Yeah, that's
cool,
really cool.
you know? And then I just got to the point where I was missing, I felt like I was missing something. I know I still wanted to do research, but something in my job just didn't feel entirely right. And I found completely by accident, I found a radiographer assistant job. So I'm like, okay, let me see what this is all about. And it brought me directly into contact with patients. So I was there in CT, MRI, X-rays, dealing with patients, helping them, get changed, talking to them and sharing their experiences with them. And I quite liked it. And fortunately, I had a really supportive manager, and she was just like, Z, you're really good at this. Why don't you go and do the full degree and become one of us, a radiographer?
Cool.
And I'm like, okay, I suppose. Why not? So I went on to do diagnostic radiography at St. George's Medical School in London, and it was one of the best experiences of my life, because
Wow.
I got to go to so many different hospitals on placement and see different things and different specialist centers. And I was fortunate enough that when I qualified, where I used to work as an assistant, they gave me a job as a newly qualified radiographer.
Oh, wow.
So I was doing that for a couple of years, and on the side, I was doing my own research. So I was doing literature reviews and things like
Oh,
that.
cool.
Because in my profession, we have a society that releases a monthly magazine, and they have a research magazine as well where you can submit your articles to. So that's what I was doing. I was just submitting articles to them, and it's nice seeing them in a little magazine. And yeah, and then this year, fortunately, it was halfway through the pandemic. So in March, I saw a job offer for a research radiographer.
Oh,
And I'm
wow.
like, this
That's
is my
perfect.
jam. This is what I want to do. So
Cool.
I applied for it. They interviewed me over Zoom, and yeah, they offered it to me, and that's what I've been doing since July this year. And I'm loving it, and I'm involved in so many different research trials and involved with the patients as well, and I can
Oh,
help
wow.
scan them, consent them to the research trials, and writing research papers.
That's awesome.
It's literally my dream job. I couldn't have chose anything as
Wow,
perfectly as that.
congratulations.
Thank you.
That's cool.
So that's pretty much how I got into research. It's always been an interest of mine, and I've just been fortunate enough now. My full-time career is to do it.
So I know having a chronic illness is difficult, especially with making it to classes and everything. Do you have any advice for other students that deal with a chronic illness, just getting through and how to manage?
Yeah, I've actually done a YouTube video on this, and
Cool.
I've got so much in there. It's called My Survival Guide to University, and it's applicable to school or college. And I went to 3 universities, and I feel a bit hypocritical because I didn't use any of my advice in those videos.
Well, that's probably how you're able to write it. You're like, oh, if I did this.
If I did this. And I think mainly because I did not know about what was available to me.
Well, it's the whole, if I knew then what I know now.
Exactly. And it's one of those things where I would suggest, I don't know what it's like in America, but here they do have disability support services, and they can help out with accommodation, finances, and a whole load of other things as well. And if you do have a bowel condition, you can let the university know beforehand and say, hey, listen, I have this. Can I get an ensuite? Because, sharing a toilet may not be ideal for me due to the amount of times I need to go each day, and having my own little private bathroom will just help so much.
Oh my gosh, that would be amazing. Is that actually a thing?
Yeah, some of the universities
Sometimes.
here, they do have an ensuite into the rooms. I don't know if it's extra charge or something, but it is a possibility.
Yeah.
I would also suggest to tell your tutor because
Mhm.
they are most likely going to be the ones that are going to be teaching you and setting you assignments. So if you say, look, I have Crohn's disease, sometimes I may be late to lectures because I don't know the toilet situation, or I may not be at a lecture because I may be unwell, then not only will they understand, but also when it comes to extenuating circumstances for project deadlines or things, you have a valid reason to get an extension.
Yes, absolutely. I always recommend, like, in that first week of the semester, to let your the professors know,
Mm.
because I remember when I first went back to school, I was like, oh, I won't, I didn't worry about
I'll
it,
be fine.
and it was literally like the last 2 weeks of the semester, and
Yeah,
I like went, something happened, I can't remember, and they were like, why didn't you tell, why didn't you tell me? And I was like, oh. So ever since then, I make sure to mention it, because it's just like we were talking about with friends. Your friends are going to think that you're flaky and you're not showing
yeah,
up if you don't tell them. It's the same thing with the professors. They are going to think you're not taking it seriously.
exactly.
Hmm.
100%.
And then same thing for career. Do you recommend, as far
Same
as
thing
just,
for career. Yeah, I mean, I've been
yeah.
lucky enough to and unfortunately, like I've also done another YouTube about, not unfortunately that I've done another YouTube about, but the responses I've had to some of the YouTube videos that I have had done, and one was how to manage Crohn's disease at work.
Okay.
And the responses, they weren't negative to the video. They were just like, I wish I had a boss like yours. Mine is not really understanding. I can't really explain what I have to them properly. They don't see it as a valid thing, and things like that. It kind of hurts me because
Yeah.
I feel blessed to have understanding bosses. But if I had one of their bosses, my life would be so much more difficult.
Yeah.
In my old job, my boss was so understanding that I said, I need, to reduce my hours, and she was like, "That's fine. We can help. We can help you with that. We can work around you with that." And with clinical
Yeah.
work, you can't really, take a day off. But they knew that I had, I was doing all this research and had another set of skill set, and they were like, "Can you apply this to the department?" So I was involved with department audits and things like that that did help department going, look, we're doing this amount of scans in this amount of period. We need extra staff to cover this and so and so. So I found a way to bring value, even though I was reducing my hours.
Hmm.
That's what I would suggest to everyone. If you really do need to reduce your hours, but you also have another skill set which is transferable to your job and that you actually prefer and enjoy doing, show them that you're trying and making options for them. So even though that you
Hmm.
are reducing hours, you are still contributing something, and it will kind of soften the blow for them.
Yeah, that's a good point. I I've kind of always had to create my own career and be like self-employed,
Mm,
because I've always had issues with that. And that's what kind of worries me now, just going into school and trying to, maybe
yeah,
possibly have a career in
yeah.
science or the medical world. Is like, will I be able to handle that? Because I feel like the 3 month is like my limit between when they're like, okay, because I try to, I've in the past I've tried to make up for it, or, and it's just hard because not everyone does have, like you said, that understanding. So when I first went back to school, my intention was to do nursing. I was torn between that and biomedical, but when the pandemic hit, because of my heart issues, I was like, I can't get coronavirus or be exposed
Mm,
constantly. There's no way that I honestly don't know how, if I would survive that.
sure.
So I kind of shifted gears towards biomedical, but I do love to write. So I figured if I can't like work in a lab or something, at least maybe with my knowledge, I can be a writer. So you just kind of have to
Definitely,
worry,
yeah.
like figure out, I guess, how to um, make it work toward with you and reinvent yourself and just kind of go with the flow. It can be hard, but um, yeah.
100%. I mean, a lot of people, I think what this pandemic has given us is it has shown a lot of people that it is possible to work from home, and that is an
Oh
option.
yeah.
I
I
know a lot
love
of
that.
people, exactly. I know a lot of people don't, like working from home with distractions and things like that. And it is nice to go out to work and interact with people as well. But for people in our community, it can be a lifesaver to actually, you know, earn money, pay the bills, and yet feel like you're contributing to society as well.
Right. So the last topic I wanted to discuss is I saw you had mentioned in one of your posts scanxiety. I'm I think that's definitely totally a thing. So tell me more about that.
So this is one of my research interests. So there's a term called scanxiety, which is relatively new. I say relatively new, but it was introduced in 2011 by a guy called Bruce Feiler. And I think he introduced it in a newspaper. I think it was the Times or something. And it was just to describe the anxiety or distress that a person feels before, during, and after
Mm-hmm.
having a scan for cancer. And the main scientific literature does focus mainly on cancer patients, as there can be a lot of stress and anxiety associated with cancer itself, but also going for a cancer follow-up scan. So as I mentioned, it is the anxiety felt before, during, and after. So before a scan, it can incorporate many things like, getting time off work or childcare arrangements, or even getting to the hospital itself.
Money, costs, and
Money, costs,
insurance.
everything. Of course, yeah, medical insurance in America. I feel that's one of the. I would always love to go to America, but I think with our healthcare system here in England, with the NHS and getting free healthcare at the point of contact, I don't think I would move. Especially, I would. No one would cover me in America because I have a pre-existing condition, and it, yeah, it just blows my mind. But yeah, no,
I'm glad you can see that because a lot of people here in America don't see that.
no, it's ridiculous, honestly. And these scans itself, like a CT scan, is, if you went privately here in England, it'll probably cost you about, I'll say about £500
Mm-hmm.
on average. That's probably about, my math's not good, about $700 maybe, something like that.
Mm-hmm.
Um, but yeah, having these scans, you can feel anxiety, and especially like before and during the scan. If you've had a bad experience, like you can get claustrophobic, or if you're not very good with needles, or have had bad cannulation attempts, that can all contribute to the scanxiety.
Mm-hmm.
And even after the scan, especially if you're a cancer patient, you're wondering if your cancer has spread, has it gone, has it stayed the same, and all that anxiety builds up until your appointment for your results, because that's where your fears are either confirmed, or or it's confirmed that you're in the all clear, or you may need more treatment, or there's nothing left to do for you. And yeah, that just really interests me, and I really want to apply my interest in that into improving those patients' experiences, not only in the radiology department, but in healthcare overall. And I'd really love to do, hopefully, a PhD on it someday, but with Crohn's and colitis, because obviously having Crohn's disease, it's just a bit more personal to me.
Right.
And yeah, anxiety and mental health, and how it can be made worse with devices and technology that are there to help you, just fascinates me.
Absolutely.
Yeah.
I think that's a great topic. So I'm looking forward to reading what you come up with. So let's go ahead and wrap up. If you could share
Sure.
how people can find you, and I know you've got a lot of great content,
Thank
YouTube,
you.
a blog. So I'll make sure to put that in the notes and on the blog post, and I'll also share some of those YouTube videos that we talked about too.
Awesome. So yeah, you can find me on my website, www.thegrumblingut.com. I have created an educational website and platform where I go through everything which Crohn's and colitis can affect. So, health, lifestyle, reproduction, everything. And it's all been evidence-based. It's all been research. It's all been corroborated by, my peers in the scientific community as well, that this information is correct. So, and that's one thing I really want to get out there, is giving people the right information. There's a lot
I love
of
that.
false information out there.
Yeah, that makes me happy because a lot of people say, "Oh, this is a statistic or a claim," and then that's it. It's like, well, where'd you get that? Where'd you hear that from? So I've been finding that I love research as well. And so when I saw all of those, about your long list of research publications, I was like, this is cool. I love that you have that to back everything that you're sharing and you're supporting. It's great.
Definitely. And everything on my website, I have a button at the end of it that says references, and it will take you to
I love that.
to the sources. So I haven't just plucked these things out of thin air, which unfortunately people do, and they use it as a money-making scheme.
Yeah. Well, thank you so much. This was great.
No problem.
We'll definitely have to do this again when we think of some cool topics. All right. Thank you.
Thank you so much.
Please be sure that you subscribe to the blog, which is bluedreamhealth.com, where you can find additional links and information on this episode. You can also check out the digital magazine on our website, as well as find us on Patreon, where you can be a supporter.